on the FSMA Q&A session and discussion about the new NSF Import Supplier Certification program. I think we'll have a few beeps as we get going, so thank you. Thank you. All right, thank you very much for joining today. NSF International is very proud to present this webinar today to talk more about FSMA and answer your questions and discuss with you the Import Supplier Certification Program. I have a few of my colleagues joining me today to support the question and answer period at the end if we have additional time. I have we did receive several questions ahead of time during the registration process for this webinar, and so I've incorporated those questions into the presentation today. I'd like to introduce myself. I'm Carrie Allen, the Director of Certification Programs for NSF Supply Chain Food Safety. And we also have Mike Govro, the Technical Manager, one of our technical managers here at NSF. He's handling FSMA programs as well as our management systems programs such as FSSC and ISO 9001. Steve Hoffman is one of our lead auditors, very experienced in the FDA regulations, and is also here to support some of the Q&A toward the end of this conference, of the webinar. So appreciate very much their support, and they're joining me today. So first, a little bit of what we're going to cover. We'll start out with a FSMA overview. Some of the questions indicated that there's some background information required just to get started and set the stage here. I'll be giving some discussion about preventive controls, supplier approval procedures, supply chain programs, and the FSVP requirements of FSMA. We'll be talking about different acceptable verification activities for suppliers. I'm getting a few comments that there is no sound. We'll work on that. If somebody could give me a chat indicating that you can hear, if there is somebody who can hear me speaking. Okay, there's a few people who can, so I'm going to proceed with the hope that the sound issues work out as you get started. There is a call-in and dial-in number that you can join, so please dial in if you need to on your phone. It should be provided in your conference controls. Okay, and then we'll also be discussing some information about the Voluntary Qualified Importer Program that provides expedited entry of imports into the U.S. And part of that is a discussion about the FDA third-party certification program. So I'll get into more detail on each of those items. So first of all, FSMA, the Food Safety Modernization Act. This act was signed into law by the U.S. legislative process in January 4th of 2011. This regulation established preventive controls rules for food, feed, and produce, and sanitary transport regulations around the handling of products and transport. The main objectives of the FSMA regulation were to establish the accountability for proactive identification and control of food safety risks in the U.S. food supply. Also to help provide greater assurance for imported foods. So not only will products in the U.S. be subject to FSMA, but also imported foods manufactured in foreign countries will be held to the same standard. And it is the expectation that imported foods and those suppliers are evaluated for their food safety risks, and those risks monitored and verified by the importers to make sure that foreign suppliers are managing food safety compliance as well. A majority of the compliance deadlines for the Food Safety Modernization Act have passed. There are a few deadlines that are still outstanding related to agricultural water sources and very small suppliers relating to import of animal feeds and a few other areas, but the majority of those compliance deadlines for FSMA are in force at this time. And the FDA is conducting regulatory inspections against the FSMA regulations within the U.S. So exactly what is FSMA? FSMA is a set of regulations requiring a systems approach to food safety management, not just a set of inspection points, but truly the food manufacturer is required to take responsibility for understanding their products, their processes, and the ingredients and the food safety hazards associated with each of those. And how to identify those hazards to make sure that they've been identified appropriately, which controls need to be in place, what verification activities are required, and what records are required to be maintained. It is the responsibility of the site for proactive management of food safety risks. but it is the FDA that is responsible for monitoring and enforcement of the FSMA regulations. So FDA will continue to conduct food safety inspections at facilities to make sure that those manufacturing and handling sites are in compliance, and also that supplier control procedures have been implemented by food manufacturers. The FSMA regulation has provided for the recognition of some foreign government food safety systems and food inspection authorities. So on-site audits that are performed at foreign suppliers by certain recognized government food safety authorities can be accepted for compliance of suppliers. And there's also provides for the recognition of third-party regulatory certification audits, such as that I've described, the NSF Import Supplier Certification program. So I'll provide a lot more detail on that further down in the webinar. So what are the major elements of the FSMA regulation? This breakdown list here are just kind of the highlights, the high points of what FSMA covers. The hazard analysis and risk-based preventive controls concepts are very prevalent throughout the FSMA regulation, making sure that food manufacturers and suppliers are taking a proactive risk-based approach to understanding risk and food safety controls. Also, there's the produce safety rule related to the production of plant products and the handling of those products. There's a sanitary transport rule that applies to distribution companies, food manufacturers who are handling and transporting product, and also the assurance of sanitary transport of imports. Supplier evaluation and approval are very important aspects of the FSMA regulation. It's intertwined throughout all of the parts of the regulation to make sure that risks associated with suppliers are either controlled by those suppliers or controlled by the manufacturers themselves or further down the supply chain. Foreign supplier verification programs are part of that, and there are modified requirements for facilities that are regulated by other parts of the Code of Federal Regulations. So if there's a site that is not subject to all the parts of the Preventive Controls Regulation Part 117, there are other applicable FDA regulations that are required to be verified and monitored by the food manufacturer or the importers. The FDA Third-Party Accredited Certification Program, otherwise known as FDA TPP, is a program that's been written into the FSMA regulation to help with the assurance of imported food products. And that helps with the expedited entry for the certified products under the Voluntary Qualified Importer Program. And I'll be discussing that in more detail. Preventive controls. So what is that? What do preventive controls mean? That means that you've completed and documented your hazard analysis. You've identified the process steps and inputs that are identified as food safety hazards, and you've assigned preventive controls where there is severe illness or risk of death that's likely in the absence of that control. So where you've previously identified a CCP under your HACCP plan, that should be identified as a preventive control relating to your FSMA food safety plan. A prerequisite program under HACCP might now be identified as a preventive control in your FSMA compliant food safety plan. So something that previously may not have been required to be validated, verified, and monitored now may need to be under your preventive control FSMA plan. So HACCP versus preventive controls. One of the questions we received in the pre-registration was, do I have to have two different risk assessments or food safety plans, one for a GFSI HACCP requirements and one for FDA preventive controls? The answer is no. You don't have to have two separate plans or two separate assessments. The HACCP and FDA requirement for hazard analysis and risk-based preventive controls really do achieve the same objective. Is to ensure that all the hazards are identified and control measures are in place to ensure the safe food. Really, is to make sure that there's prevention of the adulteration of food. So we don't want to have handling of food product that contributes to the adulteration of food, which is then only controlled at the very end by a cook step. So the point is that all hazards are identified and controlled to make sure that that food is wholesome and safe at every step in the process. So a CCP should equal a preventive control. And like I said before, some prerequisite programs or PRPs now may be considered a preventive control in your FSMA compliant food safety plan. So your two plans should be able to live together in the same system, and you just make reference to those different terminologies through the course of your documentation and paperwork of your food safety plan. So if in the absence of a control, there is a likelihood of a severe illness, injury, or death, you must designate the control as a preventive control and verify and monitor it. You'll have to document the assessment of your process where you've identified the PRPs and as preventive controls and your CCPs as preventive controls in your plan. So a question about regulatory audit procedures. There was a question, is a FSMA audit mostly paperwork, or they are also inspections, do they also inspect processing areas? The FDA does spend time on reviewing procedures and records and evaluating the implementation of the effectiveness on the floor. So what you may be very familiar with already of your GFSI benchmark certification program, if your site has one, an FDA inspection covers the same types of procedures, looking at documentation and making sure that those things have been implemented. That evaluation process will include interviewing employees, evaluating facility condition, and monitoring the sanitation activities of the site. So the FDA may also potentially collect samples or swabs, depending on the nature of the inspection. And it is a similar in process, as I mentioned, to an auditor conducting a GFSI document review in the way that the FDA would do document review during an FDA inspection. The inspection process is heavily focused on evidence collection, and also we know that the FDA has indicated in the past where a very inspection point checklist was focused on for collecting evidence related to facility condition. They're also moving toward a more systems approach to find systemic issues versus just focusing on snapshot evidence. So diving deeper into records, looking at the evaluation and implementation of your food safety system to ensure that you have the ability to continuously comply with the expectations of the FSMA requirements. So one question is, how many FDA auditors visit during a FSMA audit? There have been tales told of the FDA showing up with large groups of auditors and inspectors to come into a facility to conduct an FSVP audit or a FSMA audit. And so this has happened in discussions with FDA about what they've been doing over the past couple of years in terms of onboarding a bunch of new inspection resources and also providing for training opportunities for new inspectors. And in their education versus regulation sort of phase with the industry, this has provided for some partnership sort of back and forth with the industry for inspectors to learn from this process as they go through the training at these large inspection events. So that's not that every FDA inspection that's happened has had large groups of people, but it has occurred where a group of trainees has attended some of these new FSMA inspections. Somebody asked the question, are swabathons a real thing? I've heard that during FSMA audits, they do pathogen swabathons of 200 to 500 swabs. Does this apply to bakeries, and do they also swab for allergens? So the FDA is doing investigative or exploratory extensive swab studies. And they do this to identify the source, type, and the distribution of contamination, potential contamination. It may be because of a for-cause audit where they've received information about a foodborne illness or a potential source of a contamination event, or maybe because of a complaint. And they would come in for a for-cause event to do an investigation to find the source of that contamination or to confirm the reports. Also, they would do these swabs to validate and verify the food safety program and its effectiveness, and to seek out contaminants suspected of causing foodborne illness. So approval of domestic versus foreign suppliers. There's some questions about what are the different verification activities that are allowed for when you're trying to comply with Subpart G of Part 117, the supply chain programs, versus complying with Subpart L of Part 1 of the FSMA regulation, foreign supplier verification programs. In both cases, it's required to evaluate your supplier, look at their performance, look at the associated products that you're bringing in from that supplier, what other risks associated with them, and then to implement a control procedure, or making sure that control procedures are in place either at the supplier or that food safety hazard is being controlled at your facility or further down in the supply chain. So in both cases, it's required to do an assessment, identify the risks, and ensure that there's a control in place for the hazard. So how does FDA ensure equivalent compliance? That's one of the purposes of the Foreign Supplier Verification Program requirements, is to make sure that foreign suppliers are demonstrating equivalent compliance to a domestic supplier in terms of regulatory compliance with the expectations of FSMA. So the importer must manage this process through the FSVP, and they have to conduct their evaluation of the suppliers, as I mentioned previously. And through that process, they approve which suppliers they are going to buy from. And so that's based on the performance, determination of risks, and where those risks are controlled. If it can't be verified that the supplier who should be controlling the risk is actually doing so, then that would make sense that that supplier wouldn't be approved as a safe source of an imported product. Those supplier control measures should be evaluated and verified. Those suppliers must be compliant with the applicable FDA regulations for that product, whether it's part of the Preventive Controls regulation or if there's modified requirements because they're exempt from certain parts of the Preventive Controls rules or produce safety rules. There might be other applicable regulations that that foreign supplier has to comply with. So those parts of the regulation should be confirmed that are actually applicable to that supplier. And then the records of evaluation and monitoring have to be maintained by the importer. And that's what the FDA is going to inspect during an FSVP inspection. They're coming in to look at your FSVP program, looking at your records of evaluation and assessment, looking at your records of reviewing whatever the verification activities were, and your determinations based on those reviews. What control measures were put in place? What corrective actions were taken? Were there any failures on the part of that supplier? So all those audit results, verification results, and records of evaluation have to be maintained by the importer, and that's what FDA is going to be evaluating when they come on site for an FSVP audit. So some questions were, do I even have to comply with FSVP? Yes, you do have to comply with FSVP if you're importing ingredients that will receive further processing in the U.S., but there are some exceptions. So if you or your supplier is small or very small, except if you're producing produce, you would be exempt from FSVP if you or your supplier is small or very small. If you are bringing in raw agricultural commodities that are not receiving any further processing within the U.S. Or finished products packaged from a recognized system country, so where FDA recognizes the government food safety system as equivalent, as an equivalent system, such as Canada, Australia, or New Zealand, if you're bringing in what they call a rack or packaged product from those countries, no additional verification is required. However, if there is any further processing happening on those raw agricultural commodities, then you would have to comply with FSVP for those suppliers. If the product being imported is a juice product, it's not required to be in compliance with 117, but it must comply with Part 120 of the FSMA regulation, so, of FDA regulations. So you would have to demonstrate that that supplier had been audited against those parts or could demonstrate compliance with that Part 120. If it's a seafood product, the fish and fishery products regulation, they have to comply instead with Part 123. So while not subject to 117, you would have to demonstrate that they were compliant with 123, that part of the FDA regulation. If the product is an alcohol product, an alcoholic beverage, or ingredients only to be used in the production of an alcoholic beverage, then you do not have to comply with FSVP for that supplier. However, that supplier must be in compliance with the applicable laws for alcoholic beverages in the U.S. So equivalent level of compliance as you would have to have for a U.S.-based facility. And you do not have to be in compliance with FSVP for a supplier for meat, poultry, or liquid eggs that are covered by USDA inspection. And just want to let you know, I do see that you are submitting some questions on the side in the chat feature, and as we get toward the end, if we have more time at the end, we will answer those directly. Otherwise, we'll review all these questions and provide a written response after the webinar. Just want to make sure you know that we will get to those at some point. So FSVP Importer Requirements. If you determine that, yes, indeed, you are subject to FSVP and you are required to evaluate your suppliers, what exactly do you have to do? As I mentioned before, you have to analyze the hazards of the imported food. You have to evaluate the performance of those potential foreign suppliers and the risk posed by the food to be imported, and then conduct the appropriate verification activities. Those verification activities might be on-site auditing, sampling and testing, or just a review of records, depending on the nature of the risk and the food safety hazard. NSF regulatory certification audit can be a solution to meet your foreign supplier verification requirements. So this new program that I mentioned, the NSF Import Supplier Certification, that is accredited under the FDA third-party program, can be used as an option to verify supplier compliance. So as we get more into that in the future slides, then I'll give you a bit more detail there. So what are recognized food safety systems? As I had mentioned earlier on, if you're bringing a product in from a country with a recognized system, there are not additional requirements for FSVP if there's not going to be any further processing. One of the questions was, what are all the points to cover to be in compliance with FSMA when purchasing ingredients and product from Canada? If the product is to be further processed in the U.S., the importer must have an FSVP to evaluate hazards and ensure those are controlled. Or if they are going to be controlled further down the supply chain, it has to be assured that the control will be covered by that further processor down the supply chain. If the product is a finished or packaged product or is a raw agricultural commodity that will not be processed, like I mentioned before, that comes from a recognized food safety system in Canada, Australia, or New Zealand, no additional FSVP is required. If the system is not recognized, then that FSVP would have to be in place for that supplier if it was coming from another country not listed there. Even if it is from one of those countries, if the importer is keeping the product refrigerated, the storage facility or distributor must monitor and control those temperatures on those products for food safety once they're imported. So that would be part of the requirements for those imported products that have to be refrigerated. So how can you get ready for an FDA FSVP audit? When the FDA comes in to perform that foreign supplier verification program inspection, what are they going to be looking at? They want to see that the food safety hazard reviews have been done. So those have to be done by a qualified individual, a qualified auditor. So there's lots of services available to help a site become ready for an FSVP audit. First, making sure that your supplier's food safety hazards have been reviewed and assessed, and you have that documented, and you can do that yourself or have a third party do that. FSVP assessments, have a third party come in to look at your FSVP program to see that you've met all the parts. That can help you identify any gaps in your system and make sure that your hazard assessments are thorough and that you've identified all the appropriate hazards related to that supplier or the intended use of that ingredient, depending on how it's going to be processed. You may develop custom audits for supplier verification that can be done by yourself or by a third party. And then there are specialized regulatory audits of suppliers to help evaluate those suppliers against the applicable regulations. So seafood HACCP audits, certified dietary supplement programs such as NSF Certified for Sport does include an audit against the applicable dietary supplement regulations for GMP. Other GMP audits, a third party can come in and conduct a GMP audit against the applicable piece of the regulation, whether it's the Preventive Controls GMPs, whether it's animal feed, good manufacturing practices, whether it's dietary supplement GMPs. And then also, as I mentioned, that fully accredited NSF Import Supplier Certification program, which is accredited under FDA, recognized by FDA for VQIP suppliers. That type of audit can also be used for a foreign supplier verification. So there's lots of different options available to food manufacturers in the U.S. to help them ensure that their suppliers are compliant and that their FSVP programs are thorough. So what are the modified requirements for FSVP? One question came in specifically about dietary supplements. Do dietary supplement manufacturers need to comply with FSVP? The manufacturers themselves in the U.S., if you're in compliance with Part 111, you're only required to comply with certain parts of the FSVP regulation. So 3 of those parts are the qualified individual is responsible for the evaluation of those specs and looking at those suppliers. A qualified individual, that is defined as a person who is trained and qualified through education and or experience in the industry, so is competent to perform those evaluation of risk. And you must identify the importer or the U.S. agent of the product to be imported. So as the manufacturer in the U.S., you have to identify who that importer is. If you are an importer of dietary supplements who is not required to comply with 111, then you do have to follow and implement an FSVP for equivalent compliance with 111. So you're the importer, you're not actually manufacturing the dietary supplement, so you yourself are not required to be in compliance with 111. In that case, you have to develop a foreign supplier verification program to look at those imported ingredients to make sure that they comply with 111. That's the FDA regulation 111 for dietary supplement good manufacturing practices. So what are some supplier verification activities? Whether domestic or foreign, the supplier's control measures have to be verified by an outside agent. So that means that the supplier can't do a self-assessment that you can then accept as the verification activity. The supplier's internal audit, for example, unless it was done by a qualified auditor who was a third party from outside that company, that you can't accept an internal audit or an assessment performed by the suppliers themselves solely as the only verification activity. That could be part of your review, but not the entire review. Record reviews, looking at various records related to the verification and monitoring of control measures. Test results, you could collect test samples yourself and send them in for assessment, or look at test samples conducted by another third party. On-site audits by the buyer yourself or by a third-party qualified auditor can be accepted as a supplier verification activity. As I mentioned, the buyer cannot rely only on the supplier's own self-assessment or record review. You have to have an outside agent or yourself conducting that assessment, and the person doing that assessment has to be a qualified individual or qualified auditor. If there are any failures in the food safety system, any nonconformance related to the applicable regulations, then the buyer has to take corrective action with that supplier, and those corrective actions have to be documented as being closed. And those corrective actions could have been identified, raised, and closed during the course of a third-party certification audit or other outside audit, but any failures would have to be verified as resolved. And then the buyer has to maintain records of all these evaluations and the audit results. So what options are there for supplier verification activities? Like I mentioned before about different ways to prepare for an FSVP audit, there's different ways to conduct supplier verification activities. NSF does have a full range of services to meet those needs. We cover verification activity audits across all sectors of the supply chain, from food to feed, primary production, packaging, manufacture, and logistics, storage and distribution, dietary supplement audits and inspections, non-food compound evaluation for those different products that are used within the food manufacturing site. Those types of products can be evaluated for compliance with the FDA regulations as well. And GMP and FSMA readiness audits. So those can give you a gauge for the level of readiness of your suppliers. So you can mandate that for your suppliers to get a sense for how ready they are for compliance with FSMA, to then set the stage for a full certification audit in the future. Maybe that would help with the preliminary development of your supply chain for your supply source, and weeding out those suppliers who aren't quite ready but maybe could be ready soon. So some of those readiness audits can be helpful there. Custom addendum. So if you want to develop a custom addendum to meet your specific needs related to your product and those risks, you can create a custom addendum to be added on to a GFSI benchmark audit, for example. Or you could add a custom addendum to the NSF Import Supplier Certification program if there were additional quality measures that you wanted to have included as part of that assessment. The specialized regulatory audits of suppliers are really good options for verification. Seafood HACCP audits, the Certified Dietary Supplement program that I mentioned earlier, CGMP audits for dietary supplements, and then also the fully accredited NSF Import Supplier Certification program against the full FDA regulations. So if you want full assurance that all the FDA regulations that apply to that manufacturer or that supplier, the fully accredited FDA accepted Import Supplier Certification program is a good option for supplier verification. And so what third-party audits are acceptable as evidence that you've done an acceptable verification activity? First of all, the auditor has to be a qualified individual. That means they have to have the mix of education and experience that demonstrates that they're competent in that category of work, and they have the ability to successfully evaluate the food safety hazards associated with the ingredients at hand. You must ensure that the audit covers the food safety hazards of concern. So you can't just accept any old audit if it's not covering the ingredients that you're concerned about. If an audit was performed that covered product A, but you're more concerned about product B that's made at that site, then that audit wouldn't be acceptable. You would need to make sure that the scope of the audit that you're evaluating has covered your products and your food safety hazards of concern. So it's important that that assessment is made so that you know what those risks are, and then also that you fully evaluated those audit results to make sure that they cover it. You must ensure that applicable FDA regulations are evaluated. So there are, for example, the Preventive Controls rules, but there might be some exemptions for that particular supplier against the Part 117. But they have to comply with other parts of the FDA regulations. So that's why it's important to do a full evaluation of what exactly that audit is covering and ensure that the service provider knows which regulations apply to the product that you're interested in having assessed. The buyer must document the evaluation of audit results and maintain all those records, as I mentioned before. And the audit can be a customer audit performed by the buyer themselves or a third-party standard. So these are the different factors that determine whether or not a third-party audit is going to be acceptable. As I mentioned, the audit from an FDA third-party accredited CB is accepted as an acceptable verification activity, particularly because it covers all applicable regulations for the product that you're interested in. So what if my supplier plant is already GFSI certified? GFSI certification programs are a very important part of the international food supply chain. There's international recognition across government programs that make GFSI programs extremely valuable for companies who are trading internationally and want to be accepted, one audit accepted everywhere. However, GFSI programs are not currently accepted by FDA for the purposes of VQIP importers. So if an importer wants to enroll in the VQIP program, that's the Voluntary Qualified Importer for Expedited Entry, those suppliers specifically have to be certified against an audit like the NSF Import Supplier Certification or by another CB who's been accredited under the FDA program. So a GFSI audit is not accepted in that case and also not accepted for certification for the FDA High-Risk Import Certification. GFSI programs are acceptable verification activity if they've been deemed appropriate according to the risk assessment conducted by the importer. So you can't just accept it at face value. The importer has to take a look at that report, make sure the scope of the audit applied to their product, covered all the applicable risks, and then do an evaluation of the nonconformances, anything that was found to be deficient, and make sure that those nonconformances were effectively closed out. So there is that process of review and verification and maintaining all those records. An audit against specific FDA regulations may provide a greater level of assurance. So it's good to have these different options in mind when considering the evaluation of the risks. So a question, will my reports be shared with FDA? So under FSMA, all supplier performance records really are subject to FDA review and disclosure. And this is because the supply chain program requirements of subpart G of the Part 117 Preventive Controls rules, and also the foreign supplier verification program regulations require that the importer or the buyer do the evaluation and maintain records. And so those records have to include the audit results, the evaluation, and the evidence that any nonconformances were closed out. So those records that could be subject to reporting and disclosure to FDA through the process of FDA inspection could be GFSI third-party audit reports, second-party audit reports, regulatory audits, or test records. Buyers must review verification records and document those evaluations and maintaining those records, and they have to keep on file the supplier audit procedures and results, the supplier nonconformances, and supplier corrective actions. So that's part of the supplier evaluation process, makes all of those records subject to reporting to FDA through that process and potential disclosure, and that's all outlined in the regulation that's part of FDA expectation, is that there's transparency in the record keeping as to the supplier performance. So I want to go back to a little bit to what this FDA third-party accredited certification program is, otherwise known as FDA TPP. FDA laid down these rules for the third-party accreditation program in order to certify foreign suppliers as compliant with FDA regulations. NSF, as I mentioned, has been accredited as a CB under the FDA TPP program. You can ask for that service by name. It's the NSF Import Supplier Certification Program. In this process of accreditation, the CB certification body has to demonstrate competence and capability to operate a program. So the CB has to know what they're doing, have qualified individuals, qualified auditors, have a process for training and maintenance of competence, and a process for managing the certification cycle. So understanding how to manage audit scheduling qualified auditors, making sure that the audit is performed according to the correct scope, ensuring that the audit is performed in the time that's required depending on the scope of the operations. Any nonconformances are raised, there's calibration and consistency among auditors, and any nonconformances are closed out with appropriate evidence prior to certification being issued. So all of these factors weigh into the competence of the certification body, among other things, and is considered in the accreditation decision of a certification body. So NSF is very proud to have become accredited under this program for FDA to supply certification against FDA regulations. And so why did FDA establish this program allowing for the accreditation of third parties to offer certification against FDA regulations? Essentially, it was initially developed for the VQIP program, that's the Voluntary Qualified Importer Program for expedited entry into the U.S. This program helps, as I mentioned earlier, suppliers and importers with a good track record. It helps prevent delay at the border. So those products get expedited entry, they get to the front of the line. If any sampling or testing is required, those samples get to the front of the line at the laboratory. So there's fewer delays, and it's easier to get products to market in the U.S. So it's a great program for those importers and suppliers that have a high level of confidence with the FDA already, and a prerequisite to being able to be a VQIP supplier is to achieve certification under this program. And also, I mentioned previously, the FDA may determine that certain suppliers and products are considered high risk. And that could be because of an ongoing food safety incident, could be related to other detentions of products at the border, of related product types. It could be from issues going on in the country of origin. So if the FDA has determined that a product or supplier is high risk, they can mandate this certification at that foreign supplier site. And so it has to be conducted by a certification body who's been accredited under the FDA TPP. And as I've mentioned several times through the course of this webinar, also, this same certification audit that's accredited for FDA regulations can be used as a supplier verification activity. A little bit more about the Voluntary Qualified Importer Program, or VQIP. Like I mentioned, it provides expedited entry of product into the U.S. It acts like a fast pass, gets you through the door faster. You don't have to stand in line. VQIP suppliers must be certified against the FDA regulations by an accredited CB, like NSF, NSF's Import Supplier Certification Program. And the U.S. importer, it's important to remember, it's the U.S. importer who enrolls with the FDA for VQIP. The suppliers get the certification audit. The foreign suppliers get the certification audit by the accredited CB. the importer has to register all of those certified suppliers and products in their application for VQIP. So the first thing that has to happen is the suppliers get certified, the products get listed, and then the importer registers with FDA to become a VQIP importer. And then they get the benefits of expedited entry for that next cycle. And I believe the application cycle for VQIP begins every October, and the benefits begin, I believe it's at the beginning of the calendar year through the next calendar year. The FDA does have a very useful website with lots of good information and guidance for companies interested in becoming VQIP suppliers or VQIP importers. So what is the NSF Import Supplier Certification Audit? It does not replace FDA inspections in the U.S. or at foreign sites. The FDA can still go in and will still go in and do their own inspections for FSMA compliance. NSF, as an accredited CB, would be conducting these audits at the request of the supplier or the importer to go and certify the foreign supplier or even the domestic supplier if it's for supplier verification. It is an audit against FDA regulations. As I mentioned, it covers all the FDA regulations applicable for the product in question. It includes a document and record review and an on-site facility audit every year. And if there's a seasonal product, there could be more than one certification audit in the course of that year. And also, if the certification audit is being conducted for the purposes of VQIP or for FDA high-risk import, those audits are required to be unannounced all the time. So if it's being done for a VQIP importer supplier or for FDA high-risk import, the import supplier certification audit must be unannounced. If it is being conducted for the purposes of foreign supplier verification as a verification activity not for VQIP or not for FDA high-risk, it does not have to be unannounced. So keep that in mind. And sample collection and testing is possible depending on the nature of the product in question. So what are the auditor qualifications for the NSF Import Supplier Program? NSF's accreditation under this program does confirm that the auditors are qualified auditors. So the importer does not have to question whether or not the person who conducted the activity was qualified or not. Just by virtue of the accreditation to the FDA TPP, the auditor performing the NSF Import Supplier Program audit is qualified. That is one of the requirements for supplier verification activities, is that the auditor be a qualified auditor according to the FDA definition. That requires a post-secondary education degree or diploma, food industry and auditing experience, HACCP certification, auditor training, and competence in FDA Preventive Controls for food safety evaluation. So NSF requires that all of their auditors become trained and certified in the FSPCA or equivalent PCQI training. That's the Preventive Controls Qualified Individual, or the equivalent for seafood HACCP or produce safety rule. So depending on the scope of the audit, the auditor would be required to have the appropriate training in the FDA regulations that apply. So who needs the NSF Import Supplier Certification for FDA TPP? As I mentioned, it's a required prerequisite certification for those suppliers supplying VQIP importers. It's required to participate in that program. It is required as a condition of entry if the supplier or the product has been deemed high risk by FDA and it's been mandated that this be completed. And that can happen, as I mentioned, for a history of food safety issues or other ongoing food safety incidents. And as I mentioned several times, it is an option for domestic or FSVP import supplier verification. So if you're a specifier who's deciding what supplier verification activities you want to have performed, this is one of your options. So that is the end of my presentation and also the end of some of the questions that we had submitted to us prior to the start of the webinar. And it's about 9 minutes till the end of the hour. So we've got lots of questions in the chat feature. So I think what I will do is take a look at, I guess I'll scroll back up to the top here and take a look at the questions that came in order. And then any that we don't get to, we can provide a written response afterwards. Also the ones that were submitted prior to the start of the webinar during the registration, I will send out written responses. Everybody will get a copy of those responses. A question that I have here, is a FSMA audit different from FDA regulatory inspection? No. If it's the FDA doing it, it's the same thing. I'm just using a different word. It really is the inspection process by FDA. It's just the applicable regulations that are being audited against. Okay. And I have Mike Govro and Steve Hoffman, who've been unmuted. So if you want to mute your line until you have this need to speak, that would be fine. There's a little bit of echo in the background, but next question is thermal processing is a kill step. If thermal processing is a kill step, do our processes need to be validated, or can we use data collected during research of similar processes? That's a good question. I think it's dependent on your specific situation, but a validation sometimes can just include what has become understood to be accepted based on data that's been published in the industry. So I can't speak to your specific situation, but definitely data that demonstrates the kill step for that specific process may be sufficient. If we receive material from a distributor and not directly from the source, do we need to follow FSVP? You would need to make sure that that distributor had done so. And if the distributor is not performing an FSVP, which they should if they're the importer, it really depends on who the importer is. That's where the responsibility lies. So if that distributor is the importer, they're responsible for making sure that there's an FSVP, either the supplier controlling the hazards, or that they have gotten written assurance from any customers that any hazards will be controlled down the supply chain. Because obviously the distributor is not going to be controlling hazards unless they're monitoring temperatures for refrigerated products. So you would actually treat that distributor as a domestic supplier to make sure that they had done what they are responsible for if they are the importer. So you're either going to have to comply with FSVP or with Subpart G of Part 117, the supply chain program. The next question, do we have to comply with FSVP with empty package, which will be filling foods? So if you are bringing in an empty package into the U.S., you're importing packaging that would be used, you would need to treat that as an input into your process, but it's not a food itself. So you would need to evaluate that package as part of your inputs for your own food safety plan within your plant. So if there's a hazard related to that package, potentially, for example, maybe it's exposed during shipment and it gets exposed to fumigant, that would be a problem. Or the material lining the package itself, is it going to be altered because of the component that's going into it? You would need to consider those types of things. So if there's hazards related to the package, you would need to consider those as part of your own food safety preventive controls plan. But it, from what you're describing, does not sound like it would be handled by FSVP. If our supplier is importing raw materials that they use to produce a material for us, which firm needs to comply with FSVP? It's the importer who's importing that material. So they either have to identify what the hazard is. Is the hazard being controlled by the supplier overseas? If not, is it being controlled by your supplier? And if not, then they need to get assurance from you that you will control it. So the FSVP itself is the responsibility of the importer. But written assurance is possible. The importer is possible to get a written assurance from the next step in the supply chain if that's where the control measure is for the hazards. There's different ways to comply with that. There's a question here. We had a recall in 2017. Do we qualify for VQIP? If no, after how many years? So if you're a foreign supplier and you had a recall in 2017, you would be potentially eligible as a supplier to a VQIP importer in 2021, I think it would be. If you were the importer yourself and you had a recall, I believe it's also a 3-year limitation. And you, in addition to that 3-year good history, you also have to be operating a quality assurance program for all of your suppliers. That includes essentially the FSVP requirements. So it's good to keep that in mind. You have to have a developed supplier approval and monitoring program in addition to your 3 years of good history. I highly recommend visiting the VQIP website for guidance on this. It's very clear, and there is a technical assistance network number and a community where you can go and ask questions online to help you with some of those questions that are directly answered by the FDA as well. Take advantage of all of those resources on the FDA website. It's very useful. Will or does NSF have a certification for food facilities? Not dietary supplement facilities. Yes, we do many different kinds of certifications for food. If you're specifically asking about for VQIP suppliers, yes, we have this NSF Import Supplier Certification program that we are now offering. And we also offer GFSI certification programs, BRC, SQF, IFS, FSSA 22000, all of those. And in addition, we have proprietary audits as well that we can offer, whether it's a GMP audit, a FSMA readiness audit. There's various other audits that we offer as well. So definitely keep in touch with us what you'd like. Question, a buyer with a PCQI can go to the supplier and verify their program. Yes. Yes, if you have a qualified auditor on your staff and you want to conduct your own audit at your supplier for your supplier verification activity, yes, you can absolutely do that yourself. Next question. FDA TPP is available at all countries like Japan, Korea, etc. So if you're a foreign supplier in Japan or Korea and you would like to have the certification audit under FDA TPP, yes, it is intended for foreign suppliers in the way it was initially developed for VQIP suppliers. But whatever the reason is for your wanting that, yes, we can deliver that in your region. Next question. We are a USDA regulated facility in Canada. Can our importer apply for FDA VQIP? So it sounds like your products are under the purview of USDA. I don't believe it would be necessary. I think your importer could, but the FDA regulations would not apply to your products if your products are under USDA, so it wouldn't really make sense. I don't think that it would be necessary to do that. That's a good question, though. I'll look into that a little bit more, how exactly that would be handled, because the FDA regulations wouldn't apply. There is not an audit against, a similar audit against the USDA regulations for the VQIP program, so it's just for FDA imports. Let's see. Okay, we're right at the hour. We have several questions more that I will have to address in a written response. I really appreciate all those really great questions. I'm intrigued by the USDA one. I'll have to look into that more about how that would fit into the VQIP. I don't think it would apply, though, but thank you very much for everybody's questions. And I have an email address here that you're welcome to contact if you have more questions or you want more information about NSF services. Please email foodsafetysolutions@nsf.org. And sorry, Mike and Steve, I did not give you a chance to answer any questions. I just barreled right on through. So I appreciate your being there as backup for me, though. Much appreciated. Thanks, everybody on the line. We have a good crowd, and I'm looking forward to hearing from some of you in the future. Thank you.